Good evening, everybody. Welcome to this week's Always Shine Your Light webinar. My name is Kay Aubrey Shemaine, and I'm the owner and director of Grand Adventures Ranch, a holistic equine wellness center in southern Arizona. And tonight, our topic is the quicker you get to it, the quicker you can fix it. All right. And we're going to talk about two different distinct types of problems: acute problems and chronic problems. Of course, we're talking about problems in our horses. Now, health issues that are acute are usually brief and very severe. They are more intense. They're usually more serious. Not always, but it's active and it's more painful. Okay? So, fresh wounds, laminitis that's just come on, recent muscle strains, spinal subluxations, chiropractic issues, colds, things like pigeon fever, influenza, viruses that come on very quickly and very harshly. Okay? Whereas chronic issues are usually longer duration. Um, they are they flare up. They tend to go away, come back, go away, or never really getting cleared up, just subsisting. And then this would be things like metabolic disorders, Cushing's cancer, thyroid issues, DSLD, things that we may not even see coming on, and then all of a sudden we have a full blown problem and they stay that way for a very long time. Long term laminitis that turns into founder is this way. And primarily scar tissue and adhesions, which is much of what we're going to talk about tonight. So, whether we're dealing with chronic or acute issues, we're going to talk about how getting to it quickly can be key. Okay? So when we're looking at injuries, obviously injuries begin as acute. Any kind of trauma is something that's fresh, it's new, the nerves have just been cut or bruised, so it's more painful, and they're more likely to be life-threatening immediately. Okay, not that chronic isn't, but instant life-threatening problems are usually acute. Okay, and if the balance of the whole energetic system of the horse is not rebalanced properly, the body may not be able to heal completely. And so we might fix the wound. For example, this mare, you can see she's got a big hole in her neck. It's obviously life-threatening. She's lost 60% of her blood volume. And the immediate thing is to stop the bleeding, get her sewn up, prevent any infection, clean it all out, that sort of thing. But that's not the whole issue. When trauma injuries are left to heal on their own, they often go into what we call the injury cycle. They get hurt, there's a lot of pain, the muscle goes into spasm, and because of that spasm, there's reduced circulation, the muscle atrophies. This puts more strain on the ligaments, so the horse doesn't move as much, so we get adhesions, which are an internal scar tissue, and when the horse moves again, those adhesions break apart, which causes more pain, and it's just a vicious cycle. Bowed tendons are a perfect example of this, that they go into this injury cycle, and unless you can stop the scar tissue, stop the adhesions, they never come out of those bowed tendons, and the scarring just gets worse and worse and worse. Okay? But if we can break that cycle by intervening, and I usually intervene with energy therapies. I use photopuncture, but photopuncture, acupuncture, good massage, Reiki, things that can break the injury cycle and prevent those muscle spasms, then it's less likely that scar tissue is going to develop, and the more quickly that mare, or any horse that's had a trauma can recover. Okay? So the faster we stop or prevent muscle spasms altogether, the less likely it is we'll get that scar tissue to develop. So we need to balance the whole horse. That mare had destroyed not only her carotid, her vagal nerve, the jugular vein, but also she'd torn the esophagus and the trachea. Huge hole in the neck. but she had also energetically damaged three very important meridians for getting more energy back into her body: stomach, small intestine, and large intestine. She'd cut up her leg. So here are two of those. You can tell just right where that wound is that she had damaged both the stomach and the small intestine meridians. So the flow on that side, not just of blood, not just of nerve supply on the vagal nerve, but also of chi, of energy flowing through the body, that was disrupted. And if left disrupted, that could have caused total shutdown energetically of her entire left side. Okay? So we used photopuncture, kind of a crappy picture, but this is us treating that mare with lights to open up. My right hand is on stomach 36. I think my back hand is on a bladder point. But this was daily treatment. We treated stomach points. We treated the meridians on both sides of her body to reestablish energetic flow. Even though she had cut through those meridians at the neck, by the body, just in the same way that it can put down new other tissue, it can redevelop that energetic flow, find new pathways and work around. Okay? Within seconds of treating her with the lights, we had gut sounds, we had digestion going on, and within 8 weeks of using light therapy to stimulate the healing, which is a whole nother process besides just the photopuncture on specific acupuncture points. Within 8 weeks, you can see this bottom right picture, that wound was completely closed. But more importantly, a year later, you wouldn't have known she'd ever been damaged. And I think she's 31 or 32 now, and she's a perfectly happy old pasture queen. She did lose some weight this last year. She's putting it back on now. But for her age, she's really great, and you would not see that wound or the imbalance from side to side unless you got really, really fussy with it. However, if we don't intervene quickly, this is where scar tissue builds up. And scar tissue is blocked, the same thing as having blocked energy. Okay? It's very dense, it's very tough for energy flow to move through it. So not only can the adhesions prevent proper moving of the ligaments and the muscles in their sheaths, because the sheaths will adhere to each other, but topical scar tissue can prevent joints from moving correctly, from having full range of motion. And the body then compensates. So maybe the horse can't move that back left hock correctly, so it starts putting more weight on the right side. And then that puts more weight on the left fore. And we end up with a total imbalance in how the horse moves because it really can't utilize that back left leg correctly. All right. That compensation sets up the body for an overall imbalance from front to back, side to side. Okay. Once that has set in, it takes a whole lot longer to repair. If we could have gotten in and stopped the muscle spasms and prevented scar tissue on day one, it would take a lot less time to have the horse overcome this injury. But if it gets to the point where it's long-term stagnant scar tissue, it can be a lot harder to ever bring them back to full range of motion and full athletic ability. So, takeaway, acute wounds are often easier to overcome than chronic ones. It may not seem like it at the time, okay? It may be really scary because you've got blood and the horse isn't able to walk and all of those things. But if you can treat them right then, instead of letting them sit around, it's going to be easier to deal with. And chronic, we don't have to go up with those chronic conditions that set up that cascade of alternative imbalances that have to be overcome. In the same way, when we're talking disease processes instead of wounds, the longer and farther it's gone, the harder it is to reverse it. But sometimes it's really hard to know when a disease begins. His hair was a little longer this winter, or gee, his energy isn't as high, but So we overlook small imbalances, or they come on so gradually we don't notice them. But metabolic failures like this horse with obvious Cushing's disease took months or years to become established. Might be through poor nutrition, insufficient energy to the endocrine system. It might have even been subluxations, chiropractic imbalances that pinched a nerve or caused pain so the horse stopped moving. Any of those things, including toxicity, poisoning through, poisoning our way to health, all of those things can bring on these disease processes long before we ever know that it's happening. And if it didn't get that way overnight, it won't balance overnight. When people ask me how long we have to work with their horse, I ask how long it's been this way, and most of the time they can't tell me. So it's really important to stress to horse owners, to um, uh, uh, your clients if you're a therapist, okay, that it's not a magic pill. I don't care what surgery, drug, special food, you've already invested in. It probably, if it's long, slow, and chronic, is not going to overcome overnight. Energetic balancing can speed that process, for one thing, by letting the body determine what needs to fix first. It's like a peeling of the onion. But the longer it's been left, the longer it's going to take to fix. So, this is the best argument for fixing it before you know it's there. Fix it before it appears. One of the best reasons I have for having photopuncture around is by scanning the horse with the scanner. We often find things that we can't explain. Gee, I wonder why that point came up hot. But who knows what we just prevented from happening by getting that energy flow to come through correctly. We may have just put off ulcers. We may have just prevented impactions. We may have just prevented lameness issues that never showed up because we fixed it before we knew it was there. And this is one of the best reasons for educating your clients after they've seen you fix something acute. Talk to them about regular tune-ups to prevent things that are chronic. This way they never come up. So again, moral of the story, the quicker we can get to it, the less time it takes to fix. Wounds, sprains, allergies, they're all alike. They fix faster with a whole body approach. And you never know what you're preventing and how much money you're saving when you do regular energetic maintenance. Now, for those of you who are ready to dive in a little bit deeper into learning about meridians, energy points, Chinese medicine in general, our new Equine Energy Mastery webinars are starting up this week. You do not have to come live, but we will be live for 90 minutes once a month on Thursday nights. And then if you want just the one webinar, you have 2 weeks access to the recordings and the materials. Or you can sign up for the entire series, which will last once a month for 6 months at minimum. And you can just go to the link that you see there on the screen. If you're ready to get started becoming a professional photopuncture technician, or you want to learn more about our other classes, our equipment, please go to our website, photopuncture.com. And thanks for joining us tonight.